Okay, so today I am going to be going over how to give an intramuscular injection. We are always going to make sure that we identify the patient according to agency policy. We would attend to standard precautions, hand hygiene, good body mechanics, patient privacy and safety. So the first thing we're going to do is make sure that we are getting the right syringe and needle. So syringe size usually is between 1 and 3 millimeters. And then the needle size is going to be, we would be using between a 21 to 25 gauge, as well as 1 to 3 inches length for an adult, and 1/2 to 5/8 inches for a child. So if we are needing to mix the medication or the medication needs mixed, we're going to make sure that we roll it in our hands to mix it. And then we would also make sure that we clean the top of the vial with an alcohol swab. When we're done with that, we are going to start the process of drawing up our medication. So we are going to make sure that we are drawing up the air and the amount of what is prescribed for the medicine. And then we would make sure that when we inserted it, it would be right in the middle, and we would turn it upside down, 90-degree angle. We would then expel our air into our vial, making sure that our needle is past the fluid mark. And then after that, after our air has been expelled, we would then withdraw the amount that is prescribed. So after that, after we've withdrawn our medicine, we are always going to make sure that we are getting the air bubbles out. Actually, when it's in our vial, we're going to be assessing for air bubbles because we might need to withdraw more medicine after expelling the air bubbles. And we're always going to double check and make sure that we have the right dose. So we would verify again that it's the correct amount that we will be giving our patient. The first site I'm going to show you is the deltoid site, which is on the arm. We are going to completely expose his arm. We are going to locate the acromion process, and we are going to take about 2 to 3 fingers down from that, below that. And then we're going to kind of draw an imaginary line on the maxillary crease. And then once we have our imaginary triangle, we are going to, our injection site will be right below our two fingers. Our next one would be our rectus femoris, which is not a very common site. So basically, we are going to just be dividing up our leg in thirds from our knee to our groin area. And that third little space there, right anteriorly, would be our site of injection. Okay, for the vasodilators, I'm going to either set my patient in supine or have them sitting down. We are going to locate the great trochanter and the femoral lateral condyle. So then we are going to place our hand on the greater trochanter and kind of just form like a rectangle. We are going to envision imaginary lines between going down the center, each side going long ways and widthwise. And about that center of that point is where our injection site would be. Okay, the next site would be our ventral gluteal. So we would place our index finger on the anterior superior iliac spine, and then our middle finger would be towards the iliac crest. We would also have our patient laying on their side with their knee slightly flexed. Right in the middle of the triangle would be our site of injection.
So we're going to make sure that we cleanse the injection site before giving our shot. We are going to use our non-dominant hand to hold the skin taut. And then we are also going to use a 90-degree angle when injecting the shot. After we've injected it, we're going to stabilize the syringe with our non-dominant hand. And then with our dominant hand, we're going to go ahead and press the plunger down about 5 to 10 milliliters. After we're done with that and we've injected all of the medication, we are going to follow the line of the injection line, bring it out, and we are going to make sure to place our syringe in a biohazard container. And then we are going to make sure that we blot the site, hold pressure to it, and bandage it if it needs it. For the Z-Track method, we are going to, before injection, we are going to make sure that we put 0.2 milliliters of air into our syringe. In doing so, we're also going to displace the skin about 1 to 1.5 inches. And then we would use the same procedure as to using the 90-degree angle for injection. We would also wait 10 seconds before removing the injection from the injection site. For mine would be my card I picked was the hepatitis B. There was no, I got lucky because there was no conversion with this one. It's 0.5 milliliters. This one for every 10 micrograms is 0.5 milliliters. I am using a 3 millimeter syringe, and I would bring it to the halfway mark when inserting air and when getting the medication.
The Band-Aid on it. So if we are going to be recapping a needle, we are going to make sure that our cap is either against something that's like a hard surface, flat surface, or we could even use a cup and have it face the opening side up. So we would use the swoop method, and we would just kind of go in just like this and recap it, and then make sure it gets into a puncture resistant container or biohazard.